Clinical Pearls, brought to you by Medicom Oncology.
Hi, I'm Dr. Stuart Goldberg. I'm a member of the Division of Leukemia at the John Thorpe Cancer Center in Hackensack, New Jersey, and I'm here at ASCO 2017. Our group had the honor of being part of the group that has studied a novel agent known as CPX 351. And at this meeting, we're presenting additional findings from the registration trial, which we hope, on CPX versus 7 and 3 conventional chemotherapy in older adults with acute myeloid leukemia. We're focusing at this meeting on a subgroup analysis and looking at the site of care for consolidation. CPX is a novel agent. For many years, we've used standard cytarabine in combination with either daunorubicin or idarubicin in a combination known as 7 and 3 to treat most of our patients with AML. CPX is a liposomal form of cytarabine and daunorubicin. One of the advantages of CPX by putting it into liposome is that every little droplet will have a 5-to-1 molar ratio of cytarabine to daunorubicin, so that the optimal concentration is delivered to every cancer cell. And this hopefully increases the effectiveness of the agents. So it's a new drug delivery system of two conventional agents we've looked at for many years and treated for patients with AML. At last year's meeting, we showed in a randomized trial in older adults with secondary AML, AML developing out of myelodysplasia, AML with high-risk cytogenetics, that the combination of the drug CPX beat the combination of 7 plus 3. Specifically, at 1 year, 42% of the patients treated with CPX were still alive, compared to only 28% for the patients treated with conventional 7 and 3. And at 2 years, 3 times more patients with CPX were still alive. At this year's ASCO meeting, we're showing that in the CPX arm, patients would receive consolidation, which can be done as a 90-minute infusion in the office, as opposed to standard 5 and 2 consolidation, which required hospitalizations. So it could cut down the number of hospitalizations for patients treated with CPX, and yet the outcomes still, even in the patients who received outpatient therapy, were maintained. So the site of administration did not change the outcomes, and therefore our patients don't need to go through hospitalizations, and hopefully reduce costs. So that's CPX, hopefully going to the FDA this year, and we may see a new agent for us in the treatment of AML this year.
Clinical Pearls, brought to you by Medicom Oncology. Don't forget to subscribe to the Medicom Oncology podcast channel for more clinical pearls. And be sure to visit managingaml.com for more practice resources.